get a call late one night from the retirement home where your elderly father lives. He has a high temperature, respiratory distress, and is extremely confused. He is a diabetic and has a wound on his foot that has been being treated at the home. You meet the ambulance at the hospital, and after being evaluated, your father is admitted to the intensive care unit for sepsis. Do you know what sepsis is, how it's diagnosed or treated? Sepsis is a serious medical condition that is caused by an overwhelmed immune system's response to infection. Your body releases chemicals into the bloodstream to fight the infection, and this causes widespread inflammation. The inflammation may result in organ damage. Blood clots develop during sepsis and reduce the blood flow to the limbs and internal organs, depriving them of vital nutrients and oxygen. In severe cases, one or more organs may fail. In the worst case scenario, patients can have a life-threatening drop in blood pressure called septic shock. This in turn leads to failure of the vital organs, causing death. Severe sepsis affects more than 1 million Americans each year, and as many as half of these die from the condition. The most common cause of sepsis is a bacterial infection. The infection can come from something as harmless as a scraped knee, or something more serious like pneumonia or urinary tract infection. Hospitalized patients can contract sepsis from surgical incisions or bed sores. Certain groups of people are more susceptible: very young babies, the elderly, HIV, cancer, or transplant patients. Also people with other health-related issues such as diabetes or kidney disease. Anyone can get sepsis. What are the symptoms of sepsis? Probable or confirmed infection, fever and shaking chills, a body temperature of greater than 101 or less than 96.8 degrees Fahrenheit, rapid pulse, rapid breathing, a low blood pressure, altered mental status, decreased urinary output, nausea, vomiting, and diarrhea. The first step to successful treatment of sepsis is a quick diagnosis. If sepsis is suspected, the doctor will perform a broad spectrum of tests and exams to look for bacteria in the blood or body fluid. They will look for the source of infection using CT scans, X-rays, and ultrasound. The doctor will have lab personnel draw specimens for blood cultures and lab tests. They are checking to see if the patient has a high or low white count with a low platelet count, acidosis, which means too much acid in the blood, and altered liver or kidney function. The patient will be assessed for low blood pressure, rapid pulse, and breathing. Persons diagnosed with sepsis are usually placed in the ICU unit, where the doctor begins treating them with a broad spectrum of antibiotics which kill many types of bacteria. They use IV fluids to regulate the blood pressure and oxygen to maintain normal blood oxygen. Once the bacteria causing the infection has been diagnosed, the doctor can switch to a drug that targets that particular bacteria. Depending on the severity and the effects of the sepsis, the patient may need a breathing machine or kidney dialysis. Sometimes surgery is needed to drain or clean an infected site. Permanent organ damage can occur in patients who survive, and 28 to 50% of sepsis patients die every year. However, early diagnosis and intervention can improve these numbers. So once again, if you suspect that someone has sepsis and they are exhibiting any of these symptoms, early diagnosis and treatment are the key to a successful recovery. Most people with a mild case of sepsis can make a complete recovery. The most crucial step is early diagnosis and intervention.